peak cold and flu season, but symptoms like coughing and fatigue could be a sign of something else. To spotlight this serious and often overlooked condition, Dr. Julie PHILLEY with the University of Texas and Philip LEITMAN is here with us today to talk about what the condition could be. So, doctor, let's start with what NTM lung disease is and what are the symptoms.
NTM stands for non-tuberculous mycobacteria, and these are types of bacteria that live in our environment that can actually infect the lungs in certain individuals. Symptoms like cough that won't go away, often despite multiple rounds of antibiotics, fatigue, sometimes shortness of breath, and even patients can cough up blood at certain times with this type of lung infection.
Okay, so where are people likely to be exposed to NTM?
NTM is common in our environment, and I want to point out something that I would like for the viewers to know, and that is that this is on the rise. It's especially common in Texas. We think that we're going to diagnose as many as 100,000 new cases of this in the United States in 2018 alone. And so these bacteria live among us. Fortunately, they don't make us, the majority of us, sick, but people with underlying weakened immune systems and underlying lung disease can be pre-exposed to these infections. In addition to that, it's more common in women than in men, and it's more common as we get older.
Mr. LEITMAN, can you tell us more about your wife's experiences as an NTM lung disease patient?
My wife's experience was both challenging and wonderful. Unfortunately, because there wasn't a lot of information at the time, it took a number of years for her to become diagnosed. That allowed some more extensive damage to the lung tissue, which is why it's so important for people to know about it and be tested. Once she was diagnosed, she was determined to battle it. She lived an additional 18 years, had therapy almost continuously, both multiple antibiotics as well as things like respiratory clearance, exercise, and had a great quality of life. We had a lot of time, but it took a commitment. That was something she wanted to do, and I wanted to do with her, as did our family.
Tell us also how your wife's experience with NTM lung disease impacted you as a caregiver.
Initially, there was some shock and fear, but once we got going with it, I realized what a privilege it was to help Fern battle this disease and take the meds, make sure they were on time, and do the various therapies to help her clear her lungs out so that we could continue to live, see our children grow up. So it was a mixed bag, but it was her attitude, a positive attitude, that really helped. What I do believe is that an earlier diagnosis will help prevent some of the damage that happened to her lungs and have better outcomes. The other thing is there's a lot of interest in this disease now at the research level, at the industry level, and that's going to help bring more things to the marketplace to help people. And patients should access information. When Fern was diagnosed in 1996, there was almost nothing on the internet, and most of us weren't using it. So in 2002, Fern wrote a website, A Patient's Perspective. So that's one of two excellent websites. Hers, when she developed, is ntminfo.org. The other excellent website is aboutntm.com. Patients and even physicians are going to these websites. That's why I think we're seeing more cases diagnosed. And I believe that the more awareness we have, the more awareness that's out there, thank you for doing this, the more patients are going to be diagnosed.
All right, very good. Thank you so much for being here. Important information.
Thank you for having us.
Stick around. Coming up after